So a big part of your practice is helping people that have TMJ problems, like associated with migraine headaches, neck pain, back pain, things like that.
Exactly.
So what is the treatment option? And tell me about the success you're seeing.
All right. So in our office, we treat these patients frequently. They come in, and many times they come in and they have pain just in their jaw joint, or pain in their muscles around their jaws, or they know when they open and close, they bite into a sandwich, their jaw pops, it clicks. But they can also have neck pain, upper back pain. They can have headaches, migraines. So these patients come into our office, and many times,
so it's the way their teeth are coming together? They're causing a problem?
Yes, the way their teeth are coming together and their bite, so the way their teeth fit together, can cause a host of issues, one of them being TMJ problems.
Okay.
And so, everyone, the TMJ is, of course, the jaw joint. It's right here in front of the ears. So, it can mask itself as ear pain or ringing in the ears as well. Even dizziness issues, vertigo issues as well.
So do you have patients, though, that had these problems and now they're gone just because you fixed the way their teeth came together?
We fixed the way their teeth come together, and all of a sudden their headaches are gone, their neck pain's gone, their jaw pain is gone, and we see these improvements. It's fascinating. It's one of my passions now, just because I love it, because we have been seeing these patients for some time here in the office. We've been doing the same treatment, and we have patients that come in and they've been to, every physician possible. They've been to the neurologist. They've had scans done. They've had trying to eliminate, tumors and things like that because of headaches and migraines and pains that they're having, in the back of their head, and they come to us and they are desperate. I mean, they are desperate. They're ready to get out of pain.
Yeah.
They come to us. They hear that we treat TMJ. Something in their mind triggers. Maybe this is jaw related. We come to them. We've had patients that have been seeing neurologists for Botox injections, and they go every 3 months or so, and they can feel better for a couple months, and then it'll come back, and they'll have a bad month, and then they'll go back in for some more injections. But that's a continual process. They've come to us, and we've done this treatment, and we have eliminated that pain, and they don't have to worry about going to the physician every 3 months. They don't have to get those injections, and it's not a medicine. It's not a medication. So the way your teeth
come together, this is TMJ joint.
This is the joint.
What are their nerves?
So nerves and muscles, yes.
So they get irritated or something?
They get, the muscles get tight, and the nerves can get pinched, and so that causes the pain and the discomfort. And the sounds, people open and close, and
the popping,
the popping of the jaw joint.
A little popping here and there is not normal?
Well, but it is not normal, no, because if the jaw joint's popping, that's a sign that damage has already occurred in the jaw joint. And so we can treat that in our office, and we've had great success with it. Great success.
So give us some tips. How could we self-diagnose we have a bite problem? A problem with the way our teeth are coming together?
Well, if you have teeth that are cracking or breaking, or teeth that have wear on them. So sometimes you can notice
like flat teeth.
Flat teeth.
That's because
kind of
what?
looks like a cow's teeth in the middle of the night. A lot of times we're grinding our teeth together.
Okay.
So flat teeth, that's a sign. But also migraines, migraine headaches, and if you struggle turning your head side to side because of the muscles here in the neck, they can get really worn out and painful. That's another sign. If you have the joint sounds on opening and closing your mouth, that's a sign.
Or you wake up with a sore jaw.
Wake up with a sore jaw. That is an obvious sign, because that means you've been clenching your teeth together. So do you have any testing in your office, like to let people know ahead of time if they're a candidate? Like, how do you know if you could even help them? So most of the time, we interview the patient.
Okay.
And I do an exam and I feel around for some different muscles that can really get overworked and get painful when they're having these issues. And from that exam, I can typically recommend, yes, this is going to help you, this is going to work for you, or there may be another underlying issue.
So they just sleep with some sort of a splint?
Exactly. It's a specially designed splint that they wear. I normally start them out wearing it during the daytime as well, because many of these patients come in and they've had these severe muscle and joint and headache issues for years and years. So we really want to, have them wearing it during the day some in the early going. But after a couple months, then we go to nighttime only. Success rate has been phenomenal. Yes, phenomenal. And I love doing it, because I love just sitting in front of the patient and saying, I'm so confident this is going to work for you, that you know, if it doesn't work, then, you know, I'll give you your money back. I don't care.
Okay.
I'm that confident in this treatment that we can help you out and we can get you out of pain, and we can relieve these pains and these symptoms that you've been having and complaining and dealing with, and that have been holding you back. You know, some people, they have migraines that can't work. You know, they can't. They'll have to go home. They have to go home.
So you've had
they're
success with
work.
migraines.
We have had success with migraines. Yep, it's incredible.
This is kind
those
of going on
patients
across the country where dentists now are getting into this.
It is.
And working with medical doctors.
It is, but it's a specific training that the dentists are having to go through.
This is after
to be able
dental
to get it.
school.
This
You
is
have to
after
go.
dental school. Yes, this is after dental school. This is additional training about learning these things, because you know what you don't know, right? So if we don't know to look for it, we can't treat it. Now we know about it. Now we know that we can treat it. Now we know that if patients come in and they have these pains and they have these symptoms and sounds and things, that we can help them, we can treat them. But it is an involved process. It's multiple visits. You know, it's not make something and we just kind of throw it in the mouth and you go home. It is, we follow up with it.
So you have to kind of adjust it.
We have to adjust
get it right.
Yes, most of the time we get patients really wrapped up in treatment after about 4 or 5 visits, and they're feeling good. Many times though, they're feeling much better, significantly better, the day they get the appliance, the day they get the mouth, the orthotic is what we call it. It's a neuromuscular orthotic, so it goes and relaxes nerves and muscles, and that's what or it relaxes the muscles, and then that alleviates nerve pain. And so it's the orthotic, so they're wearing that. So the day they get the orthotic, we follow up with them a week after, and the vast majority of the time, the week after, they're feeling much better.
Good.
Feeling better than they've felt in years. And off the medications, they're off of the painkillers, and they're not having to worry about taking those pills every day. It's great.